It is reported that India will have to spend about 1.4 billion USD to 1.8 billion USD in the first phase of COVID vaccination program in the country. India has the second highest number of COVID patients after the US. India plans to inoculate 300 million people over the next 6 to 8 months, likely with vaccines from AstraZeneca, Russia's Sputnik, Zydus Cadila and India's own Bharat Biotech. If India got 190 to 250 million shots of the vaccine under the COVAX facility, a best case scenario, then the government would need to line up about 1.4 billion USD to make up for the shortfall, according to an unpublished report prepared by GAVI, an international alliance meant for increasing access to vaccination in poor countries. On the other hand, if India received a lower allocation of 95 to 125 million doses, then the cost of the government of procuring additional shots would go up to 1.8 billion USD. By comparison, India's 2020-21 federal budget allocated just under 10 billion USD to healthcare. The COVAX plan, co-led by the World Health Organization and GAVI, aims to provide poor and middle-income countries with diagnostic tests, drugs and vaccines through a fund known as the Access to COVID-19 Tools Accelerator, set up last April. The Indian government has not provided any estimate of the cost of its vaccine program, though it has said all resources will be provided to protect the population. GAVI, an alliance of governments, drug companies, charities and international organizations, said it was in discussions with India. Providing a low range of support would exacerbate the country's ability to allocate enough resources to mitigate the risks of continued transmission of COVID-19, the GAVI report said. The GAVI report identified India's economic burden due to the pandemic as disproportionate and suggested a donor-funded plan of 1.3 billion USD to secure 190 to 250 million doses. The plan needs to be approved by the GAVI Alliance Board. According to a vaccination plan shared with international donors, India aims to inoculate 10 million frontline health workers by February, 20 million essential workers by the following month, and then 270 million people by August, mostly people above the age of 50 and those with other health issues that make them more vulnerable. India also needed 30 million USD to 80 million USD for the infrastructure to transport and store vaccines that must be kept at very low temperatures, the GAVI report said. News Desk Kaumudi, English.